I'm Dr. Isaac Wornom. I'm a plastic surgeon here at Richmond Plastic Surgeons here in Richmond, Virginia. I'm here today with Kristen. Kristen has been my patient. I was actually looking at your records before I came in the room since 2012.
That's right.
Kristen was diagnosed with breast cancer.
Yes.
And she has been on a journey since then with the treatment of her breast cancer. And since October is Breast Cancer Awareness Month, I thought would be nice to hear from her what it has been like and how breast reconstruction has fit into that journey.
Absolutely. Well, my day job is also serving as Executive Director of Susan G. Komen, Central and Eastern Virginia. So for our viewers, just to give them an idea, this is something I talk about a lot in my work, and the impact that reconstructive surgery can have on especially a young patient with breast cancer. The decision to what kind of reconstruction to have, to reconstruct or not, is so personal to women. But for me, it was a really powerful part of my journey. I think oftentimes we don't talk about the psychosocial impact of a breast cancer diagnosis and the loss of our breasts. I had a bilateral mastectomy, being really tied to our self-esteem in some ways, or our self-image. And when I was diagnosed, I was 32. And
I was going to ask you how old you were. I
32.
remember you were one of the younger women I had ever treated for reconstruction with breast cancer. Not the youngest, but one of the youngest.
Yes.
And it is a disease that is affecting more young people.
It is, and that's something we work to educate about. I am the fourth generation in my family to have breast cancer, so I knew I was at risk. And then, interestingly, because my mother had breast cancer the first time when she was 33, I had it the first time at 32. I had seen her breast reconstruction, just growing up.
Right. It was probably not quite as good as yours.
No, it was not. It's one of the things I'm most thankful for. She had her breast reconstruction. She had implants in 1983, which is sort of the dark ages of this
very
kind of
beginning. In fact, at that time, it was not widely accepted that women should have that.
They didn't even say breast on TV. I mean, it was
right.
It was still taboo to talk about breast cancer. So we've come so far in that conversation and dialogue, and similarly, thanks to physicians like Dr. Wornom who've given their life to this work, we've come so far, and you've come so far in the technique and what you're able to give us.
We have.
And it made me feel as if it sort of put me back together. And it really did. And
your reconstruction was complicated by the fact that you had to have radiation on one side, as I recall.
You're right. And I had a really large tumor. I had a 5.5 centimeter tumor. You probably remember.
And you had chemo before.
I did.
You had your mastectomies.
Yes.
And but the tumor did respond well to that.
It did.
But you still had to have radiation on the left side.
Yes.
And then I think we did one touch-up.
We did. Yes.
Because that side got firm.
It's called Capular contracture for
and it's much more common in radiated breast. Mm-hmm. But after that, they've stayed very good in their size and shape.
Thank goodness. I'm so grateful and couldn't be more pleased with the result. I think that's the thing. When I mentioned earlier the psychosocial element, I remember at 32 being diagnosed and thinking, gosh, I feel like as a woman, I just got comfortable in my skin. Like I was just, normally developing, and growing, woman. And then all of a sudden, a breast cancer diagnosis and a bilateral mastectomy, I'm like, wow, that set me back a little. I've got to get used to this new and different body again. And then, the silver lining was breast implants.
I think we made you a little bigger than you were.
We did, and I was okay
We discussed
with that.
that.
I was like, silver lining, Dr. Wornom.
Right. Well, that's a very important thing.
It is.
I mean, because women that are going through this, I often have women, they want to be smaller, they want to be bigger, they say, I'd like to be the same size. I mean, from a reconstructive perspective, we do have a lot of flexibility in what we're able to do. And those types of conversations are a very important part of the process of the reconstruction.
And I don't know if I've ever even told you this before, because I've been with Dr. Wornom now since 2012. We're actually buddies at this point. We see each other so much.
We have seen each other a lot.
We have.
Actually, I didn't see you for about 3 or 4 years,
That is
Kristen.
true, in between,
When you had to go through more chemo.
I did, yes.
Which fortunately really helped.
I know. I'm still here. I had a second diagnosis in 2016 with metastatic breast cancer, so I'm stage 4 at this point. But I was able to go through successful treatment, stabilize again, and then have a reconstruction revision. That
we like a few months ago, we did this technique called fat grafting, just to kind of touch up what was already a very nice result, where I did liposuction on her abdomen and injected it into the breast to kind of smooth them out a little bit and just make them a little better. And it was very good.
I don't know if I've ever told you this, but my first appointment with Dr. Wornom, I was terrified. I had never been to an appointment like this, and at the part where I've actually told this story in some of my talks before, when you have to do photos before. I'm a very modest soul, or came into this a very modest soul, and I'm like, oh my gosh, before photos? What? And I remember thinking, how do I
Your
smile
face
for
isn't
this?
in it.
Your
We
face,
don't put your
theoretically,
face.
right? Your face isn't in it. But I remember standing there thinking, I'm still standing in front of a camera. Is this like a mugshot? Is it like a school picture?
The
How
nurses
do I
take
pose? They were amazing for it. But I remember, it's so overwhelming as a new patient.
Yeah,
And
it is.
It is. It's like,
There's so many,
weird.
you're exactly right, Kristen. For women with a new diagnosis of breast cancer, it is overwhelming.
It is.
The number of people they have to see and the number of decisions they have to make.
Quickly.
Yeah, that is,
lot.
you are right. It is not easy.
It's new. It's so new, and just not realizing. Again, I want to dispel myths and create, help with Dr. Wornom's conversation of creating normal expectations for this. But in particular, I didn't realize when I first got into this that it's kind of like a 2-year process all in for advanced stage breast cancer like mine. It took a while between chemo and radiation and waiting between surgeries and expander placement. And I will say the expander to breast implant surgery is amazing. The expanders are
it's so much better.
It's so much better.
It does change you.
It changes, and
I tell people that.
It's true.
That you're not going to like the expander.
No, they're not.
But once we take it out and put in the implant, it's going to be much better.
It's amazing. I feel life-changing at that point. I mean, to the degree, I remember staying up all night after that surgery, looking in the mirror, thinking, "Oh, that's so much better. I really like that." This is the silver lining. We finally got there.
We actually now are occasionally, you wouldn't have been a candidate for this because of your possible need for radiation, but we're occasionally going direct to implant.
That's amazing.
Where we skip the expander.
That's amazing.
Not every woman's a candidate for that, but that's becoming more and more common. And the other change that's happened in the past 7 years, or since you had your mastectomies, Kristen, is we can save the nipples sometimes.
Yes.
We can't always do it, but that's new. That's new.
It's a nipple-sparing procedure.
Yeah, correct.
And
you can't always do it.
You can't, and that's what I wanted to sort of share, because there are a lot of questions around breast cancer. Even just the reality that it can be in the nipple, it can, or just for really high-risk cases like mine, where I have a CHEK2 mutation. There's a high risk of recurrence with a case like mine. So you tend to treat, or my physicians and team have treated it more aggressively. But I feel like there are a lot of questions that women have out there about all the differences, and then there's something else that Dr. Wornom has taught me along the way that a lot of people I feel like don't realize, and it's that as you live with the implants over time, they change how your body responds to them. It's not unusual for them to get firmer over time, and sometimes uncomfortably firm, right? And then
sometimes,
and then it can
we hope not.
Right, exactly. But it's not
variables.
It may require a reconstruction revision, which is what my capsular contraction was, but that's not uncommon either.
After radiation especially. Fortunately, you haven't gotten it again.
No,
it's
been great.
Yeah.
So, well, honestly, too, the relationship that you get to build with your plastic surgeon really does matter. I actually did see you a lot more than some of my other.
Yeah, that is true.
Yeah.
After your mastectomy, your plastic surgeon is the one you see the most.
The most.
You
It's
don't
true.
really see your mastectomy surgeon that much after they finished and they know your margins are clear.
It's true.
But we see you like weekly almost.
We did for a while.
And
yeah.
and I find that myself as well as my nurses and assistants that help me, we all develop very close relationships with our patients with breast cancer.
You do.
Because we
know
really
it.
get to know them.
And we get to know them.
And
which
you
is
ask
really
us
fun.
questions. We
do.
try to, if we don't know the
It's
answer,
true.
we try to find out.
Well, and I've often said that Dr. Wornom, and you know this, is one of my all-time favorite physicians. I absolutely adore him because
You're
he's
so kind,
funny.
Kristen.
No, it's true, but he's funny and he listens to country music when he operates. And I know this because I've been awake for some procedures. But
I do
it's
like
really fun.
country music.
It's true, right?
Yeah,
And
it's true.
These little things that you start to know.
Yeah.
So, they know my
I like other
birthday.
kinds of music too, but I like country music.
It's true, and it's just fun to kind of know those things and realize that you have a real, you have a real relationship with your physicians, and you feel cared for and comfortable. I think that's it's been a huge blessing for me.
Well, I think that you're a perfect example of somebody whose attitude helps you stay well.
Thank you. Thanks for that.
And being well is more than just being disease free.
It's true. And I would say this is
and
part of it.
you're still dealing with breast cancer.
I am.
But you're still well.
Yes. Thank
I don't
you.
consider you as sick.
Thank
you know. And I think that breast reconstruction has so much to do with that.
It did for me. Again, just psychologically, there was something impactful for me about feeling sort of put back together again.
Yeah.
And I recognize that that's unique for every woman, but it really did matter to me to look in the mirror and, kind of feel my confidence again and think, okay, in some ways I like this better than
Yeah.
before. I'm like silver lining, right?
Right.
So I felt great in my skin again, and
Thanks.
I appreciate it. It changed
Thanks
my
for
life.
sharing.
Yes.
Thank you.
Absolutely, thank you.
Okay.